Well, the taxi strike in the Western Cape has also had an impact on health services in the province. The Department of Health says some facilities were targeted by arsonists last night, while others had to be closed because workers could not get to their workstations. The Western Cape Health Department COO, Dr. Saadiq Kariem, joins us tonight for more on these developments. A very good evening to you, Doctor. I'm grateful for your time. So today, there appeared to be a lull in the disruptions and the violence. Was it a better day for health services?
Today was somewhat better than yesterday and last night. And as you said, unfortunately, vandals targeted the Nolongile clinic in Khayelitsha last night, and they essentially completely trashed the clinic. Yesterday, we were forced to close a number of clinics. Unfortunately, given the volatility of the situation, we had to continue the closures today. So between the province and the city of Cape Town, unfortunately, we closed clinics in 37 areas right across the province. That includes the metro and the rural. And obviously, people now wouldn't be able to access those clinics and those services. And there's been a significant impact on the hospitals as well.
Mm-hmm. You said 237 centres had to be closed across the Western Cape. Is that right?
37. 37.
Oh, 37.
Yes.
Right.
37.
So of those centres then, put in context what it means for the ability of the health department to do its work. So the number, for example, of patients that you see daily who then would have suffered as a result of these closures.
So obviously between the 37 clinics, there would be several hundreds of people seen on a daily basis. And we've had to close those centres for the last 2 days. We've also had to, unfortunately, significantly downscale, in fact, the elective operations at our big hospitals, particularly Groote Tygerberg and the Red Cross. So those elective surgeries were actually quite urgent, and we now have to postpone that and bring people back, hopefully, in a few weeks, possibly even a few months. So it's been a significant impact. So the impact on patient care has been quite significant.
Speak to us about the sort of surgeries then that are covered under the elective category, which will now have to be postponed, and whether the waiting list was already long before these postponements, because in parts of the country, other provinces always talk about a backlog in getting to these surgeries, especially after the COVID period.
Absolutely. And I mean, post-COVID, we've in fact been making quite a lot of progress at reducing the backlogs in elective surgeries in the Western Cape province. And unfortunately, this setback just contributes now further to those backlogs. And so we're going to have to work harder in the coming weeks and months now to try and overcome the backlog. So it's quite unfortunate that these incidences of violence has had such a significant impact on the health sector.
Do we know how many of these elective surgeries will now have to be pushed back, specifically because of disruptions related to the taxi strike?
We're still calculating the actual number of patients involved in elective surgeries, but to give you an example of a typical elective list at the hospital like Groote Tygerberg, there could easily be 20 of these lists per day, and each of these lists would have anything between 3 to 6 to 7 people perhaps per list. So multiply that over these big hospitals over the couple of days has been quite a significant impact. But we've also found that in a total, over and above the 3 big central hospitals, Groote, Red Cross and Tygerberg, we've had to reduce the services at 8 other regional and district hospitals across the province. And so this is going to have incalculable costs and impact on patient care.
And in terms of staff, Doctor, who are turning up, or those who are unable, in fact, to turn up because they're unable, for example, to board a bus, a train, because there are just so many people who are now also seeking alternatives to get to work or live in communities where it is simply unsafe to venture out. Do you have a proper breakdown of how many are coming, how many are unable?
Yes, so we've been watching those staff numbers quite obviously detailed numbers, watching those numbers carefully. To give an example, at the Metropole services, we probably had between 40% and 50% of staff who were able to report for duty. Much the same picture at the bigger hospitals and also in the rural, some of the rural areas. I'd say between about 40 to 50% of the staff were in fact able to come to work. At Tygerberg Hospital, for example, the number was well over 300 nurses who couldn't get to work simply because they couldn't access transport, given the difficulty that we have with the transport routes.
And are your facilities secure? I mean, you mentioned the break-in at the facilities around the Khayelitsha area just last night, but is there enough of a police presence, enough security to ensure that those workers and patients who are in your buildings at all hours of the day are actually protected?
So all our facilities, we have security at all our facilities, including the clinics in some of these volatile areas. And what we've done is we've increased the security at these facilities. But we also work quite closely with the Provincial Joint Operations Center. That's where all the security cluster sits, including SAPS and law enforcement agencies are all part of that JOC, as we call it, the Prof JOC. And at the JOC, we are able to monitor the situation. And if security is required in particular areas, we can immediately call on SAPS or on the City of Cape Town law enforcement agencies to come in and support us. And in fact, we've been doing that quite regularly in what we call our red zones. So these are areas that are so volatile that our vehicles and ambulances cannot even access the areas. Mitchell's Plain last night, for example, was virtually on complete lockdown. None of our vehicles could get in or out of Mitchell's Plain. Our staff couldn't get in and out of Mitchell's Plain either. So it's been really difficult trying to manage healthcare services in this volatile situation.
So there are some very clear no-go areas. I wonder if we've seen largely coverage of the situation in Cape Town, if the situation is as volatile in the smaller towns around the city.
It's equally volatile in some of these smaller towns. So, for example, we had to close a clinic in Worcester. We had to close Nduli Clinic in Ceres. We also had to close some clinics in the George area. So the smaller towns have also been affected by this. And another area, for example, was in Bukweni in Paarl, where we also had some trouble. And those volatile areas, unfortunately, people then cannot access these services. In addition to that, there's been quite a significant trauma load that our hospitals have seen over the last couple of days. We looked at the data, and just to give you a sense of that increase in trauma load, if we looked at the data from Thursday morning 0800 to today at 1700 hours, in fact, I found that there were just about 5,400 cases of trauma across our facilities. And that is, in fact, a 20% increase on the trauma load of the same period in the week before. So there's been a significant increase in trauma load as well, and that would obviously be as a result of the increase in violence.
Do you know for sure that these are people who were injured in the violence that accompanied this taxi stairway?
Yes, in quite a number of cases we do, because obviously people would have been brought in by our vehicles or managed to get to hospital on their own. We had, for example, the incident at the airport, on the airport approach road, that turned quite violent and ugly, unfortunately, and there were, I think, 2 fatalities from that incidents alone. So a number of these, a few days ago, a number of these incidences happened inside of our community health centers. At Vanguard Clinic, for example, we in fact had to close the clinic because some of the community members stormed the clinic when one of the members who had been shot was in fact being treated at the facility.
Lastly then, Doctor, how much longer before the situation or the impact on healthcare from the stairway becomes a crisis? I know it's expected to end tomorrow, Wednesday, but even that at this stage doesn't seem guaranteed. So how much longer would you be able to continue in this way before it becomes a crisis?
Well, I'm only hopeful that the resolution, that this impasse can be resolved quickly between all the role players. I know the province and the city are working quite hard at resolving this impasse. We are prepared to, and we have these joint contingency meetings that meet twice daily, and we again meeting tomorrow. We're hoping that by Thursday all of this would be resolved.
Dr. Saadiq Kariem from the Western Cape Health Department, COO, in fact, in the department. Good to speak to you tonight, sir. Thank you very much.